Hello, I'm here to talk to you about COVID-19 vaccination program. We're hoping that by understanding more about COVID-19 vaccines, you'll be actually able to make up your own mind about having the vaccination. This information is provided by Queensland Health, and it's the most up-to-date information as of the 20th of July, 2021. I'm Dr. Margaret Kay, and I'm a GP, and I'm Senior Lecturer with the University of Queensland. This video is actually about what can you actually expect on the day of your vaccination. So if you go and have your vaccine, you should have already been booked in and then you arrive for your vaccination. Hopefully you've already understood a lot about the vaccines by actually getting some reputable information from the government, from your GP, from your other health providers to ensure that you know more about COVID-19 vaccines. On the day, you can request to have an interpreter there if you need one. It's free to have an interpreter, whichever vaccination centre you go to, even if you go to the local GP. And that GP is likely, or that vaccination centre is likely to provide you with quite a lot of information about the vaccine you're about to receive to ensure that you can provide a proper informed consent. So when you go there, it's important that you're well for your vaccine. If you're feeling unwell on the day of your vaccination, it's very important that you don't go to have your vaccination. It's important that you think, oh, I've got some symptoms and I'm not well, and postpone your vaccination. If you have symptoms that could be related to COVID-19, it's important that you let someone know so that you can actually get tested. Do not go to the vaccination clinic. Do let them know you can't make it. Do reschedule. But if you have a cough or diarrhea, fatigue, fever, that loss of smell, runny nose, shortness of breath, sore throat, vomiting, nausea, those sorts of things are things that could be COVID-19, and you actually should immediately get tested. So it's important to go to the nearest testing clinic, not to the vaccination centre. So can I get the vaccine if I'm waiting for the COVID-19 test results? Well, even if you're feeling better, if you haven't got those test results, you don't know whether or not you're negative. So it's very important you have a negative result before you actually go and get your vaccination. Should you take Panadol before your vaccination? And the answer is you do not need to take Panadol or Nurofen or any other treatment before you go and get your vaccination. You can have some Panadol at home in case you need it for some mild side effects afterwards, but there's no need to pre-med yourself with some medication like Panadol or Nurofen. Can I still get the flu vaccine? Flu vaccines are really important this year to make sure that we don't have influenza distributed through our community as well. And if you're over 6 months of age, we encourage everyone to get the flu vaccine, but you can't get the flu vaccine at the same time as the COVID-19 vaccine. And there needs to be at least 7 days in between your flu vaccination and your COVID-19 vaccination. So just double check when you had your flu vaccine, or wait at least 7 days after your COVID-19 vaccine before you go and get your flu vaccine. But they're both important. They're for different types of viruses. So the COVID-19 vaccination will not protect you against the flu, and the flu vaccine will not protect you against COVID-19. So what happens on the day of vaccination? It can take a little while to process a lot of people, so allow at least 45 minutes to an hour for your appointment. You will be asked to sign a consent form, or at least to speak to the fact that you consent to have the vaccine. You'll be asked a lot of questions about your health to make sure that you're okay for the vaccine. And you will get the vaccine usually in the upper arm, and then you'll be asked to wait for at least 15 minutes afterwards. Even if you're feeling fine, they will want you to wait just to make sure that there's no immediate reaction to the vaccination. They will ask everyone to do this. If you have very severe problems with allergy, it's important that you talk to the provider of the vaccination before you actually get your vaccine so that they're aware of that. Also, as you leave, make sure you book in for that second dose. It can be hard to remember when you had the last dose and when you're due. Just have that booking ready and make sure you keep that booking close so as you know where it is. And you don't need to isolate after you get the vaccine. You're not infectious. You haven't been given any infection by having the vaccine. So what do you need to bring to the vaccination appointment? It's really important that you actually bring anything to do with the booking confirmation. Some people get a code for the booking, photo ID, a signed letter from your employer if you need to prove that you're in a disability or aged care sector, or a health worker, your Medicare card if you have one. If you don't have a Medicare card, that's fine. So long as you've booked in, you can actually still get your vaccination. Information about any medications you're taking, and also information about any health conditions, significant health conditions, and information about any of the vaccines that you've had in the last couple of weeks, just so as the health providers who are delivering your vaccine are aware of all that information. So how is it that my personal information is used? A lot of people are worried when they're actually booking in for vaccinations that people will have access to this personal information, and they wonder how it's going to be stored, and even whether or not the vaccine is going to be stored somewhere. It is absolutely imperative to understand that everything about health is kept secure. The Australian law says that it must be kept in a secure manner. So everything, including a record of your COVID-19 vaccination, will be kept in a very secure way. And after you've had that vaccination, your vaccination record will include the COVID-19 vaccine, so that in the future, you'll be able to prove that you've had that COVID-19 vaccination. And you can ask the vaccination provider to print out your immunisation history so as you can actually have that statement with you if you wish. But you can get it yourself from the MyGov account, or you can call Medicare and they'll be able to provide that information for you, because it'll be captured in the Australian Immunisation Register for you. For you, it's your personal information and it's stored securely. So do we need to actually keep social distancing and wearing face masks once we've actually got our COVID-19 vaccine? The answer is yes. It's very important we follow all the rules. Stay 1.5 metres away. Wash our hands constantly with soap and water. Stay home if we're sick. Don't go near other people if you're feeling unwell. Don't go to the pharmacist. Actually ensure that you get tested first. Get tested if you have the COVID-19 symptoms we talked about. Wear a mask whenever it's required. The public health organisations will let you know when it's required, and check into the venues that you do go to, because if someone else is infected, you need to know if you have the potential to be infected as well. So it's very important we do all of these things to keep our community safe. So what about trusted sources for information? Well, make an appointment and talk to your doctor, and they'll be able to explain more information about the COVID-19 vaccine. You can call 13 COVID Health. 13 COVID is 134268. And anytime, day or night, they'll be able to answer your call, and they'll be able to get an interpreter for you and give you the information you need. And you can book in for that vaccine if you wish to after talking to them. The National Coronavirus Health Vaccine Helpline is also available anytime, day or night. And if you need an interpreter, then just ask for an interpreter. Multicultural Connect is another organisation in Queensland that actually can provide information from Monday to Friday as well. And then there's also the website. There is lots of really good, detailed information available at the Queensland Government website. If you need an interpreter, remember it's free at your local doctors or any of the vaccine clinics. Thank you.